Uganda, Dr. Pamela Chi. I work at the Ministry of Health, and we've been handling, of course, receiving Lenacapavir. We started this process way back in 2025 when the product became available through the innovator, which is actually Gilead. And so the government of Uganda took immediate steps as one of the few African countries actually to start introducing this medicine in our country. So we planned and we were able to access this medicine in March of this year. And in April, I think many of you were able to see that the drug was actually launched in Lira, where we provided this Lenacapavir to our people and making sure that they're actually able to access for HIV prevention. The drug is really used for people who are at substantial risk of acquiring HIV. And it is important that we continue to actually use other tools for prevention of HIV, especially among the young people, where abstinence is the most effective tool, but also people need to be faithful, but also use of condom. And besides the Lenacapavir, we have other drugs for the prevention of HIV that are also available in our facilities. We have been distributing this drug to a number of facilities. For this year, we shall be covering about 104 health facilities. They are all over the country, mainly public health facilities, but also they are in PNFP facilities. The drug is free to those who actually need it, and when you actually go there, you will be tested, and for HIV first you have to be screened, and then you'll be provided information on how actually to take care of yourself when you're taking this medicine. So then once you have actually met all the criteria to be able to be eligible for Lenacapavir, a person is then provided this Lenacapavir. We have limited doses because this being an innovator drug, the innovator drug means that somebody holds this patent. And when they do that, we have to work towards making generic options where other manufacturers that are actually able to produce this medicine. So we have limited quantities of this drug. It's not even a matter of money so much, but it's mainly capacity for the manufacturer to be able to provide this medicine for people. Uganda is not the only country that actually needs it. There are many other countries. So you're competing with many other countries to be able to access these doses for your country. So we received a limited supply of this medicine, enough to actually initially provide about 19,000 doses for our people. But we have many more that we expect at the end of this year. But also next year, we should be able to get much more, of course, through the government, through the Global Fund, but also through the US government will be providing Lenacapavir. And when we get this, we should be able to expand to many more facilities, roughly about 300 of those that have been enrolled. Those in our record, we haven't summarized that, but we know that the drug is actually being used by those who actually want them. The demand is available. The next, for the consignment that is expected for this year is still significant, but again, I want to say the point is that we have already planned for that group, and we have had the ceiling for it. When that consignment comes, it will be provided to those people. Is that if someone has started learn, we need to make sure that when they come for their next dose, they're actually able to receive it. So that is very important for us. And then you continue slowly to actually bring in many more people. That would be it's a very important tool. Medicine is a very important tool because we need them to prevent disease, like Lenacapavir is good for prevention, but also there are drugs for treatment that we actually need to take them. Now, when you're actually taking a drug, it's important that you take a drug to treat a condition for which a drug has been prescribed. It means that when you're given medication and you've been asked to take this drug, for example, for 5 days, and you take every 8 hours, let me say that, it is important that you follow those schedules and be able to take your medication as per the schedule. When you do that, then the medicine is able to work and give us the results that we actually need. When we don't follow those procedures and those timelines, then the drug will not be effective, and the virus or the bacteria will actually find other ways of protecting itself against the medicine. And when it does that, we start to develop what we call resistance, meaning the medication can no longer work, or you need to actually look for other formulations. So for everyone, and all of us have taken medicine, it is very important that we actually follow medication schedule and follow the dosing that we have been provided.